Welcome. Today we're diving deep into a specific type of heart disease called syphilitic aortitis. This condition, although less common today thanks to advancements in antibiotic treatment, is a serious complication of untreated syphilis. Understanding this disease is crucial for historical context, recognizing potential late-stage presentations, and appreciating the importance of early syphilis detection and treatment. Syphilitic aortitis, as the name suggests, is caused by syphilis, a sexually transmitted infection caused by the bacterium Treponema pallidum. When syphilis is left untreated, it can progress through various stages. Tertiary syphilis, the final stage, can occur years or even decades after the initial infection. It's in this late stage that Treponema pallidum can attack the aorta, leading to aortitis. The pathophysiology of syphilitic aortitis is complex. Treponema pallidum infiltrates the vasa vasorum, the small blood vessels that supply the aortic wall. This infiltration triggers an inflammatory response, leading to endarteritis obliterans. This obliterative endarteritis compromises the blood supply to the aortic media, the middle layer of the aortic wall, leading to medial necrosis, scarring, and weakening of the aortic wall. This damage can lead to three primary complications: aortic aneurysm formation, aortic valve regurgitation, and narrowing of the coronary ostia, the openings to the coronary arteries. Syphilitic aortitis was more prevalent in the pre-antibiotic era. With the widespread use of penicillin, its incidence has drastically decreased. However, it still occurs, particularly in developing countries and in individuals who are unaware of their syphilis infection or who do not receive adequate treatment. The prevalence is higher in men than in women and typically manifests several decades after the initial syphilis infection, typically between 40 and 60 years old. The signs and symptoms of syphilitic aortitis can be subtle and develop gradually over many years. Many individuals are asymptomatic in the early stages. As the disease progresses, symptoms may include chest pain, shortness of breath, a cough, or hoarseness due to pressure on surrounding structures from an aortic aneurysm. Aortic valve regurgitation can cause symptoms of heart failure, such as fatigue and swelling in the legs and ankles. Narrowing of the coronary ostia can lead to angina, chest pain caused by reduced blood flow to the heart muscle. Diagnosis of syphilitic aortitis involves a combination of clinical evaluation, serological testing for syphilis, and imaging studies. Serological tests, such as the VDRL and RPR tests, are used to screen for syphilis, and confirmatory tests like the FTABS are used to confirm the diagnosis. Imaging studies such as chest X-rays, CT scans, MRI scans, and echocardiograms can help visualize the aorta, identify aneurysms, assess aortic valve function, and detect coronary ostial stenosis. While there aren't strictly types of syphilitic aortitis, we often classify it based on its major manifestations. These include aortic aneurysm, which is a bulging or weakening of the aortic wall, aortic regurgitation, where the aortic valve doesn't close properly, causing blood to flow backward, and coronary ostial stenosis, a narrowing of the openings to the coronary arteries. A patient can exhibit one or a combination of these complications. The treatment of syphilitic aortitis involves treating the underlying syphilis infection and managing the complications that arise. Penicillin is the antibiotic of choice for treating syphilis. Surgical intervention may be necessary to repair aortic aneurysms or replace a damaged aortic valve. Medications, such as vasodilators and beta blockers, may be used to manage symptoms of angina and heart failure. Regular monitoring is essential to assess disease progression and adjust treatment accordingly. Prevention of syphilitic aortitis hinges on preventing and treating syphilis. This involves practicing safe sex, regular screening for syphilis, especially for individuals at high risk, and prompt treatment of any identified syphilis infection. Public health initiatives aimed at raising awareness about syphilis and promoting early detection and treatment are also crucial. The prognosis of syphilitic aortitis depends on the severity of the disease and the presence of complications. Early diagnosis and treatment with penicillin can halt the progression of the disease and improve outcomes. However, once significant aortic damage has occurred, the prognosis is less favorable. Recent research is focused on improving diagnostic techniques, developing less invasive surgical approaches for aneurysm repair, and exploring novel therapies to reduce inflammation and prevent aortic damage. While syphilitic aortitis is less common than it once was, understanding this condition remains important for healthcare professionals. Thank you for watching.